If open heart surgery feels too risky, there's another way doctors can repair a leaking mitral valve. Mitral regurgitation means the valve between two heart chambers doesn't close fully, so blood leaks the wrong way each beat. Untreated, severe leakage can cause breathlessness, fatigue, swollen ankles, and repeated hospital stays for heart failure. The MitraClip is a small implant placed on the valve leaflets through a thin tube with no chest incision needed. Doctors usually consider this procedure when surgery is too risky and symptoms persist despite optimal heart failure medications. A heart team uses detailed ultrasound, including a probe through the food pipe, to map the valve before deciding. Under general anesthesia, the doctor inserts a catheter through a vein in the leg and guides it up to the heart. Guided by live ultrasound and X-ray, the team positions the clip above the leak and grasps the two leaflets. Once the leak is sufficiently reduced and the valve still opens well, the clip is released and stays permanently. Most patients stay in hospital 1 to 3 days, resume light walking within days, and avoid heavy lifting for a couple of weeks. Like any heart procedure, risks include bleeding, stroke, rhythm changes, or a leak that may return over time. Surgical repair, valve replacement, or optimized heart failure medications remain important alternatives the heart team weighs carefully. Many patients notice easier breathing, less swelling, and better daily energy in the weeks and months after a successful clip. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost? Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.